I am making an impression for mandibulectomy case. You can see the patient was diagnosed with squamous cell carcinoma, and and the oncosurgeon did nice surgery and reflap graft. Now the problem with this surgeries are there, the mandible is shifted on right side or whichever the surgical site is there. So now we have to rehabilitate it through guiding appliance. For guiding appliance, we have to make impressions. There are lot many challenges. Patient has got dry mouth, mouth opening is restricted, there is trismus. So we have to make an alginate impression and then we have to modify it. In this condition, I have made an alginate impression and I modified it. Now I am making final impression. So I will show you how to make final impression. So I am using this polyether impression material from Pentamix. So we have to fill it. Don't have to overfill it. Just slightly fill it so that we can easily push in the sulcus area and interdental spaces. There are lot many undercuts, so first you have to remove those undercuts and then you should make these impressions. मुंह is a very जीभ ऊपर उठाओ जीभ ऊपर उठाओ ask the patient to raise the tongue, but in this condition he is not able to raise the tongue because of the surgical part, and partial glossectomy was also done in this case. So the basic thing one should follow in making any type of impression: apply petroleum jelly over lips and perioral area so that this impression material don't get stuck to the patient hairs and other area, so you can easily remove it. Second important thing that has to be considered, you have to check the tray multiple times patient mouth, whether there is any hindrances, whether there any blanching, whether any soft tissue impingement. Okay, then clean the area. You have to do a superficial gloss scaling in this condition before making any impression. Fourth important thing is sharp edges, sharp edges over the tooth. You have to make it rounded. Okay, very important. You have to remove the undercuts, because if undercuts or any tilting is there, then it is very difficult to place the guiding appliances. And if at all the patient is diagnosed by you that he might have a carcinoma in the mouth or CA anywhere, so make sure that you should make prior to surgery, you should make a diagnostic impression. That is very helpful. Even in this case also, I have suggested the patient to go for impression, but somehow, patient get panic and even he's been not guided properly by the onco surgeons and all. So this happens. So there is a lack of teamwork in such condition. See, I have seen that this impression is getting set. So you have to remove it very gently so that the beauty about this material is polyether. It got very good rigidity. So you can easily remove this. You can see the impression is nicely captured entire area. So thank you guys. Thank you very much. Close.